On behalf of our entire team, I would like to welcome you to the Barretts Esophagus Comprehensive Clinic at Northwestern Medicine. I'm Dr. Sri Komanduri, a gastroenterologist specializing in Barrett's esophagus here at the Digestive Health Center. We realize that you've been given a lot of information up to this point and may have questions about your condition and the options you have. We've developed this video to provide you with key pieces of information about Barrett's esophagus and your treatment. You can rewatch this video at any time. We've broken the information down into different sections or modules, so you can be sure you understand the information before moving on to the next module. After talking through the basics, this video will focus on endoscopic therapy of Barrett's esophagus, which is the most common treatment for this disease. Of course, if you have any questions, please feel free to contact us at any time. We'd be happy to answer any questions you may have. The modules will cover information about Barrett's esophagus, treatment options for Barrett's esophagus, endoscopic therapy, the procedures, what happens after endoscopic therapy, and finally a summary. You can share this information with your family or people who are helping to care for you so they also can understand the disease and treatment options. You've been given a diagnosis of Barrett's esophagus. Let's first spend some time to talk about what Barrett's is exactly and what it means for your health. The esophagus is a muscular tube that carries food from your mouth to your stomach. When someone has Barrett's, the cells in the lining of the esophagus change, so they no longer look like standard esophageal cells, but instead look like intestinal cells. This change happens because your esophagus has been damaged by stomach contents such as acid. Barrett's esophagus is a serious complication of gastroesophageal reflux disease, which you have probably heard referred to as GERD. You may have already had symptoms of GERD, such as heartburn, indigestion, and regurgitation. What is important to know about Barrett's esophagus is that not everyone has symptoms, so you may have been surprised when you were diagnosed with it. What is happening is that anything that is coming up from the stomach is irritating the esophagus, even if you're not feeling it. So how did your doctor find out you had Barrett's esophagus if they're not always symptoms? You recently had an endoscopy, where the doctors put a thin tube down your throat to take a look at your esophagus and stomach. Even though you might not feel the reflux, your doctors could see a change in the lining of your esophagus when they did your test. They took a biopsy or a small sample of the tissue they saw from this area so they could look at it more carefully under the microscope. When they tested the small piece of tissue, they confirmed that you had Barrett's esophagus. Although you may not have had any symptoms, GERD is the most significant risk factor for Barrett's. Other risk factors for Barrett's esophagus include being male, over the age of 50, being white, having had reflux for a long time, a hiatal hernia, being overweight, and being a current or past smoker. It is important to understand the relationship between GERD and Barrett's esophagus. Heartburn, which you have likely experienced, is a symptom of GERD. GERD can lead to Barrett's esophagus, but not everyone who has GERD will develop Barrett's. About 10 to 15% of people, or 1 out of every 7 to 10 people who have chronic GERD symptoms will eventually develop Barrett's esophagus. Patients who also have a hiatal hernia are more likely to develop Barrett's. A hiatal hernia occurs when part of the stomach pushes upward through the diaphragm into the chest. You might wonder, if you're not having any symptoms, why it is so important to treat Barrett's esophagus. It's important to treat because patients with Barrett's are at an increased risk for a type of cancer called esophageal adenocarcinoma, simply referred to as esophageal cancer. We now know that esophageal cancer is the fastest rising cancer in the United States. Barrett's esophagus is not cancer. Barrett's esophagus is a precancerous condition that can lead to cancer if not monitored or treated. To better understand this progression, let's take a closer look at the pathway. The pathway starts with reflux of stomach contents. For some people like yourself, reflux leads to Barrett's esophagus. From Barrett's esophagus, the pathway may continue to what is called low-grade dysplasia to high-grade dysplasia. Dysplasia is the presence of cells in your body that are not normal. Each step in this pathway has an increased risk for progression to cancer. If you've been diagnosed with Barrett's without dysplasia, the chance of you developing cancer is at least 1 to 5 people in 1,000 per year. If you've been diagnosed with Barrett's with low-grade dysplasia, the chance of you developing cancer is at least 1 to 2 people out of 100 per year. If you've been diagnosed with Barrett's with high-grade dysplasia, your chance of getting cancer is up to 10 people out of 100 per year. We also know that up to half of people diagnosed with Barrett's with high-grade dysplasia may have cancer within 5 years. What does this information mean for you? The longer you live with Barrett's, the more likely you may get esophageal cancer. Our goal at the Barrett's Esophagus Comprehensive Clinic is to identify and address your Barrett's so that it does not have the chance to turn into cancer. There are different treatment options for Barrett's, depending on what is seen in the endoscopy that your doctor did and the results of the biopsies taken. For some people, we do what we call surveillance, which means that we keep an eye on how things are going by doing endoscopies with biopsies every 3 to 5 years. You may have already been in a period of surveillance if you have had more than one endoscopy. Once we start to see dysplasia, or if you have certain risk factors, we discuss endoscopic treatment options. In the past, the management of Barrett's was limited to either observation or esophagectomy for cases of high-grade dysplasia or early cancer. Esophagectomy is a major surgery to take out the majority of the esophagus. Now we are able to use endoscopic procedures to treat your Barrett's esophagus or early esophageal cancer. Endoscopic therapy gives us the chance to resect or take out a visible abnormality or to ablate, which means burn away the cells that are not normal. Endoscopic therapy is the preferred treatment for Barrett's esophagus. It is important to know that endoscopic therapy is not a one-time treatment. It is a process usually taking about 3 to 4 sessions total. These sessions will happen over the course of about 6 to 8 months. If you decide to have endoscopic therapy, you will schedule your first therapy session. Each session will take up to 20 to 30 minutes. Before your procedure, an anesthesiologist will be there to give you sedation. There are 2 types of procedures we do using the endoscope during endoscopic therapy. One is called endoscopic resection, which means taking something out, and the other is called radiofrequency ablation, or burning. These 2 treatments work together to cure your disease. In the first treatment, we will use the endoscope to look very carefully at your esophagus. In this treatment, we will resect or take out any distinct visible abnormality that we find. Visible abnormalities generally are areas with the highest degree of dysplasia, or the most abnormal cells that have an obvious appearance, such as a nodule or bump. We take these areas out to remove the abnormality and also run tests on the sample to make sure there is no cancer. If we find cancer, which happens in less than 5 out of 100 patients in the area that we take out, the pathologist will tell us if it's superficial or deep. Superficial or intramucosal cancer can be cured by endoscopic resection. However, deeper or invasive cancer will require surgery. If we do not find any distinct visible abnormality during the first treatment, you will undergo ablation of all the visible Barrett's and no tissue will be removed. Usually the next treatment will be scheduled about 2 months later. During every treatment, close inspection is performed to ensure there are no further visible lesions. If no lesions are seen, we can proceed with ablation. A way to understand why we do this process more than once is to think about painting a room. When you paint a room, you start with the first coat of paint. You let that dry, and then you come back the next day, and you see that there are a few areas that did not take. So you make sure that you touch up these areas with a paintbrush, or in this case, a smaller ablation tool. Similarly, because the esophagus is not perfectly straight, the first ablation treatment may also leave a few areas which are not completely treated. We then perform more treatments until the entire area is painted, or in this case, treated. Most patients will require about 3 ablation sessions to remove all the diseased tissue. Once your esophagus looks normal on endoscopy, we will take biopsies to make sure that there is no Barrett's esophagus or dysplasia left. In about 5% or 5 per 100 patients, the Barrett's may come back at some point in the future. Endoscopic therapy for your Barrett's requires a commitment from both the doctor and from you as the patient. We will work with you to make sure that the treatment fits into your life and your schedule. It is always important to talk about the risks and benefits of any procedure you may have. These treatments will be outpatient endoscopies. You will come to the hospital for the treatment, but you will be able to go home the same day. An anesthesiologist will be there to give you sedation and monitor the procedure. Risks of the procedure include some bleeding and the possibility of causing a small tear in your esophagus. These happen in only approximately 1 in 1,000 patients. This risk is similar to the risks of the endoscopy you already had to take biopsies. In about 5 in 100 patients, a narrowing in the esophagus may occur because of the treatment we are doing. If you develop a narrowing, you may have some difficulty swallowing. These narrowings or strictures are easily treated during endoscopy with a balloon which can stretch the scar tissue. After you have the treatment, either ablation or resection, you may have some discomfort. This discomfort is more of a nuisance in the majority of patients, as opposed to reaching the level of severe pain. It would not be expected that you would need to come back to the hospital because of pain. Your doctor will give you prescriptions for pain medications to take after each treatment. Your esophagus may be a little swollen after the treatment. Because of that, we put you on a full liquid diet for a day or two, and then a soft diet for 3 to 5 days after that. The entire process will take about 6 to 8 months. The chances of the treatment being successful are 90 to 95%. Even though the treatments are outpatient procedures, we will always talk with you after each treatment to discuss what we have done and remind you what you should do. And we are always here to help if you have any questions about your care. If you have any more questions about the risks and benefits of endoscopic therapy, please contact us. After you have completed treatment for your Barrett's esophagus, the goal is to prevent or stop it from coming back. As the patient, you'll have 3 main jobs after your treatment is complete. The first job is for you to stay on your acid medication. Endoscopic therapy treats Barrett's esophagus, but it does not treat GERD. You will still need to treat your GERD by taking your acid medication every day to control your reflux. We know that patients do not always feel symptoms. You could have reflux and still feel okay. So it's critical for you to take the acid medication every day, even if you do not have any symptoms or feel any pain. The second job you have is to adjust your diet, which will help you to control your reflux. Avoid eating late at night and have smaller meals so that you do not eat too much at any one meal. You will also want to wait up to 2 to 3 hours after you eat before you lie down. In terms of a specific diet, we recommend moderation, as we know it is very difficult to completely avoid certain foods. If you already know what triggers or sets off your symptoms, then try to reduce that food or drink. As always, we recommend lifestyle changes such as smoking avoidance and weight loss when appropriate. The third job is for you to follow up with your doctor for endoscopic surveillance to make sure the dysplasia or abnormal cells do not come back. Your doctor will tell you how soon you need to come back for an endoscopy, even if you don't have any symptoms. As you have seen, treatment for your Barrett's esophagus is a process, and it will take up to 6 to 8 months to complete. Even after treatment, we will continue to perform endoscopy, though less often, to check if the Barrett's has returned. Both the doctors and the patients have jobs to do throughout this process. To review, as a patient, your main day-to-day jobs will be stay on your acid medication and pay attention to your diet, even if you don't have any symptoms. Remember that endoscopic therapy treats Barrett's esophagus, but it does not treat GERD. You need to take your acid medication every day. By taking your medications every day, you are decreasing your risk because you are controlling your reflux. You also need to come back when you're scheduled for your next treatments, as well as your post-treatment surveillance endoscopy, the endoscopy we do after your treatment to make sure the treatment worked. We are committed to working with you to treat and cure your Barrett's esophagus. We will give you a schedule for the treatment plan and work with you along the way. Our goal is a complete long-term cure of your disease. Please feel free to share this video with your family or friends so they can understand your condition and help you along the way. Please contact us with any questions before, during, or after your treatment sessions. Barrett's esophagus is curable, and esophageal cancer is preventable. The Digestive Health Center at Northwestern Medicine is here for you, and we are committed to your health.